Ha ha ha. And we are live. The laugh's on you. Welcome to another
Great.
edition of Total Health Live, because it's far
Great.
better to be totally healthy live than totally healthy dead.
On live.
You're live.
Yeah.
Hey, so,
it would not be good to be on live for sure.
yeah, unlive. Unlive. Could be
Yeah.
recorded.
I just made that up. I think.
To be unlive. Hey, so let's see what's going on
here
today.
we are.
We're talking about, gosh, there are a lot of questions about that people have about what to do during the infamous pandemic. And there's information overload. We were talking about that just before we got on. What's your take on tuning into news without being overwhelmed by it?
Well, I think my opinion is to not have the news on all 24/7 and to actually select some of your news information. I select mine through YouTube. Like, there are certain people I want to watch. I want to hear their opinion. And so it's selective. And I definitely want to hear the mayor's presser and the governor's presser. And Governor Cuomo, I watch him on YouTube, the daily. But I don't catch all of those all the time. So you have to select which ones are credible in your point of view, and you can't listen to everybody. You can't listen. I mean, in our field, I'm also paying attention to some of our colleagues who are posting interesting information as well, interesting and relevant information. So how about you? What are you doing?
You know, I do a daily dose of about anywhere from, I do listen to Cuomo, even though several of my friends absolutely despise him. Only because I like something that's systematic with a number of facts, and I am somewhat a lover of PowerPoints because I like to see graphs and things of that sort. So I'm more data driven than anything else, but I try to stay out of too much of the political blame game. I will say that it's just important to practice good, healthy habits.
Yeah.
When you talk about the CDC guidelines, stay away from people. I just went out today and I had my bandana on because we don't have any masks. I had the bandana, I had my hat, I had covering, I had plastic gloves on because we were given from a friend of ours, wonderfully. She gave us a box of gloves. And so I went to a local produce place. In fact, I'll post a picture of me later from the car. And they were great. They maintained a distance. All the workers had masks on and gloves. They had boxes of produce ready to go. They just added milk, added oranges, and a few other items, and boom, you're ready to go. And I will tell you that experience going to a wholesaler of produce, that felt safer than going to a grocery store, because everybody was very respectful here, and they literally wiped down all of their counters and surfaces every hour on the hour. And I found that to be amazing for a warehouse.
They must get it more than the average population, I guess, because
they understand, because they are providing fruits and vegetables to grocery stores.
Right. So they're the first contact with these items, and they're going, So
I appreciate that, because the last thing they want to do is to be found out to be the source of contamination for items that are going to a grocery store, because their business is going to get shut down. So they take being essential, not grocery workers, but food wholesalers and delivery people, they take it very, very seriously. And it was just really refreshing to see.
I bet they always do, though. I bet they always do.
I bet they always do too. But more so when you see them all with masks and gloves. I'm actually looking forward to going back there someday in the future when I can actually see their faces and thank them again.
Yeah. Well, I know there was some information about the growers or the people that work on the farms here, because we have a lot of farming in Southern California and just up the road, and Oxnard and Camarillo. On the way to Santa Barbara. And, this is about 2 or 3 weeks ago. Maybe a couple of weeks ago, I was hearing some reports that the people who are working on these farms, and the pickers and the whatever, people who are working were not getting all the information about spacing and wearing masks and everything. So I think that hopefully has been remedied by now for their safety and their family's safety, and certainly everybody's safety, because they're actually before the wholesaler, right?
Oh yeah. No, farm workers, that's where you want to be having,
Yeah.
you want to have the very the very most safety.
The
The
very
most
most safety. I
safety.
couldn't have said it better.
You want to be the safetiest that you
The
could ever
safetier.
be.
The mucho safetier.
Mucho safetier. Hey, so I'm putting a link in the group here for the StreamYard. If you want to come in, and you could just click that little old link and come in and we can have a chat, because this is a group. This is all about all of you and all of us working together. So I let you in there. And if you want to come in and just chat for a bit, please, you are welcome too. Because interaction is what we're all about.
I wanted to say something about Chris Cuomo is also broadcasting on a daily basis,
right?
About his process, having the symptoms, definitely the symptoms of COVID, and he. I keep wanting to say, just go rest. Just go and get rest.
Well, that's actually what Dr. Sanjay Gupta tells him all the time. Like,
yes,
go rest.
Yes. I mean, that's the most important thing. And to also, let the fever to a certain extent run its course. That's my mother always used to say that.
You don't want to go 105 because that tends to be brain damage time.
That's danger.
But if you're 101, even 102 or 3, and you start suppressing the fever, you will lengthen the amount of time that's going to take you to recover.
Yeah. So you actually want to enhance. I mean, okay, this is what my mother used to say.
Yeah.
This is the European way, right? You just cover yourself and sweat it out.
Yeah.
Again, this is a new type of virus, and
it's novel.
It's novel.
It is the novel virus.
I also wanted to say that those are specifically the symptoms, or what he's experienced are classic COVID. I guess we could call it that. Maybe it's too early to call it that.
Not like classic Coke or the new COVID. Coke. Classic
but I just talked with my brother, who an update. I did a FaceTime with him in the hospital. Now he's no longer in the ICU. Good. So he was tested twice with COVID positive. Mm-hmm. First came into the hospital with TIA. Well, they stroke-like symptoms, and they called it TIA, and sent him home. And he and his wife, who was also positive, stayed at home. And then he was rushed into the ER last week with an actual stroke. So, so he is. He was in the ICU for 3 days, and now he's in a neurological ward specifically for COVID patients. So he is having some speech. That's what affected him. Right. That's how the stroke affected him. So he's really struggling, and he reminds me, my husband has a stroke exactly like this in 2011, and it kind of reminded me of my husband's journey. So hopefully he's on the mend. He was struggling to speak, of course, and he's getting speech therapy and physical therapy starting today. So it's so we have COVID, and we have those symptoms and how that disease progresses, but we also have COVID-induced kinds of things, like what my brother is experiencing. Mm-hmm. So it's complex. It's extremely complex, and we don't really know very much. I hope in 6 months to a year we'll, of course, know a lot more. But everyone's journey is different.
It is different, and some people experience exceedingly mild symptoms. Mm-hmm. We know one person who's just had, not here in San Diego, but who's had the loss of smell, loss of taste,
right,
and some headache, no real digestive diarrhea thing, a little bit of fever, but nothing like you're hearing from a personality like Chris Cuomo.
I haven't heard much about the digestive issues. I don't know if that's a new thing or if it is.
That was one of the symptoms, I think, at one point. It was some people, diarrhea was a big thing. So.
And you know what I think it is? I think the immune system is affected. Therefore, weaker links are affected in the body. So it is a unique journey for everyone. I mean, there are common factors, like my brother also had fever fever and extreme exhaustion. I mean, those were his symptoms.
Yeah, I saw a friend of mine who's a dentist who was proudly showing that she's got a new thermometer for scanning the forehead. And I was just thinking, if somebody's asymptomatic and they're a carrier, they're not going to be detected by using a forehead thermometer.
Yeah, good point. I mean, if you're asymptomatic, you do not have symptoms.
Right. So that's why I think the whole concept of distancing. I have another friend who keeps saying, "Well, when can we go back to work? Can't we do working and social distancing?" And I was trying to picture a dentist working on somebody's teeth from 6 feet away. So
they'll have to invent new tools, new dental tools, and magnification. And
but you're going to be doing robotic tooth extraction from the next room.
Yeah, that sounds really safe and fun, doesn't it?
Yeah, I had a great time. Good times.
No, not at all. Not at all. My husband was supposed to have a breathing treatment, or not a breathing treatment, a breathing exam in a few days.
Yeah.
And then he was going to see his pulmonologist 2 weeks later. But of course, he's not going to doctor's appointments at this point. No. Everything's telemedicine. So that's what we're going to do with the pulmonologist in a couple of weeks. Yeah. And whoever has ever had a pulmonologist, hopefully you're able to make some appointments with them if you're experiencing any symptoms.
Right. Well, and I think that's the key. You mentioned a little bit about telemedicine. There's a lot you can do just reporting to people, because I remember in our physical diagnosis classes, decades ago, one of our instructors used to say, this is 90% of what you're going to get in terms of coming up with your diagnosis comes from what the patient tells you.
Yeah.
The other 10% are the exams and the MRIs, lab work, all the other stuff like that. So if you can get 90% success with a Zoom call or a FaceTime or something like that, that's pretty darn good without having to expose someone to the problem.
They're doing a lot of Doxy Me right now. I think professionals are doing that kind of platform. But, I've noticed that all the appointments that I go to with my husband over the years, there's not a lot of physical examination going on.
No.
Maybe checking the chest, and of course the nurse does most of the of course.
Doctor walks in, reviews the chart, asks a couple of questions, writes the prescription, and exits.
Yeah. So, it's less of a physical, but chiropractors can't work.
Well, it depends. See, in Maryland, I was just talking to one of my friends. She's actually listed as essential services, whereas in California we are not. So it varies from state to state according to what the director of the health services recommends, what the governor says, and everything else like that.
But I don't think people are going to chiropractic.
Well, they actually are in Maryland, but it's way down. It's maybe about it's probably 20% of the volume that they're used to. But if somebody has a situation where they have a severe musculoskeletal condition and they don't want to go to an emergency room, God forbid you go to the emergency room and then get a COVID exposure on top of whatever horrific disc problem or sciatica you have. In that sense, it is essential, particularly if you are a food worker, if you're a first responder, if you're somebody who needs to be physically active during this time, it really does make sense to get something taken care of.
Well, this brings me to the case of, we had one of our care workers come in the other day, and she said that she works on Sunday nights at a skilled nursing facility. And she said they are now mandated as of last week to take COVID patients in skilled nursing facilities. And I was absolutely appalled, shocked, and I couldn't believe that. I mean, that's like bringing the poison into the most vulnerable population of all.
Yeah, it's very challenging. You have to have this situation because you have to be sure that you create some level of isolation. Because I remember my father, before he passed away, he was in Buffalo General, I think it was Mercy Hospital. He was on the cardiac floor, and he got MRSA. So he got this antibiotic-resistant infection, and they had to have him quarantined within the hospital. They eventually quarantined him in the nursing home. So it is possible. And they had the gowns, the masks. It was really interesting because
This,
the hospital had one set of rules as far as masks and gowns and gloves, and the nursing home had a separate set of rules as far as masks and gowns and gloves with respect to MRSA.
well, this is well, my husband also had shingles in a nursing home facility he was in. He was quarantined, and they gave him an antiviral, which he reacted to horribly and was sent to the ER. And so again, he was quarantined in this skilled nursing facility and in the hospital. I just don't think most skilled nursing facilities, the ones that I've seen, are really that equipped to be taking care of, you know, more than one quarantined patient at a time. So I think there, I mean, it was mentioned maybe hotels would be a better place for patients.
And we had in Washington State in King County, the I think it was the county executive wound up purchasing 2 or 3 hotels and motels, but with lots of very smooth, hard surfaces, which would be easier to clean, which makes sense.
Are you talking about now?
A couple
this
weeks
situation
ago, yeah.
now? Oh,
in Washington State.
Yeah, well, I think there's so much. It seems like almost that I guess we're doing the best we can, all of us, and we want to be able to calm our nervous system on an individual basis.
Have your melatonin ready.
Yeah, and get the rest you need. I mean, really, you know, whoever it is, you need to. I mean, I'm sleeping great, and I've never really had a big issue with sleep, but I know you have mentioned it a couple of times.
So usually it's because my overly active brain. I get a lot of creative inspiration. Oh, there's Mickey Peel. She says, I think it's related to stress levels. Yeah, I would say stress.
Yeah.
A lot of things, you know, if you can lower your stress level, your immune system is going to respond a lot better.
You know what I do if I can't shut my brain off? I will listen to something that is somewhat interesting, but not mentally challenging to put me to sleep.
So you wouldn't listen to me?
Yeah, no, because we'd just be like this, you know. It would not be restful.
No. It'd be fun.
Yeah, sure. But yeah, I listen to something that is somewhat interesting, but they may have a little monotone.
I like some of the meditative stuff. I even put on a YouTube video once in a while. I started listening to some of the Abraham Hicks stuff because Esther Hicks is pretty interesting to me. I don't buy everything that the whole Abrahamist thing talks about, but some of the general ideas, the general concepts of staying positive and focusing on what you want, as opposed to letting your mind wander into all the horrific situations that you fear or worry about, I find that to be relatively soothing. And within, I would say, anywhere from 5 to 7 minutes, I'm sound asleep.
You know, I love Esther Hicks and Esther and Jerry. Jerry, of course, passed away several years back, but I find her more engaging and not. So I find it too interesting to want to sleep.
It's too interesting. Esther, if you're listening, you're way too interesting for Monika.
Too interesting. And she does have a little bit, like, she's very enthusiastic, of course. Yeah. And so
she's more enthusiastic when she comes out of her little trance, actually. She sounds like a little girl almost, like, hey, everybody.
Well, so, I've listened to their information, I guess, since 1996 or so when I was first introduced to them. But there's a lot of great people to listen to. There's a lot of meditative things available. Music also.
Music is great. Deepak Chopra will put me to sleep, guaranteed. Yes, you're fine, and your sleep is going to be improving every day. Yeah, so he's got a bit of a monotone to him.
Yes, he does. I was just listening to Eckhart Tolle as well. He's got a little bit of a monotone like that too.
I almost bought an audiobook from Eckhart Tolle, and I thought, am I going to fall asleep listening to this?
Right. I mean, just find something that is going to, you know, calm you down and, you know, soothe your brain a little bit. I was watching last night Kim's Convenience on Netflix.
Kim's Convenience? What is it, a 7-Eleven?
sitcom about a Korean family that have a little
Wow.
convenience store, and it's hilarious. But that sort of doesn't put me to sleep,
Seems,
but I can only watch it for so long. But something to take you out of your thinking,
yeah.
worry, and repetitive thoughts of doom and gloom or
Well,
panic.
yeah, and it's so easy. I think. See, I don't shut off everything with respect to the news, but I'll do like an hour here, half hour here,
Mhm.
something like that. And I do look at CDC feeds and things of that sort because I'm not, in some sort of a weird mood where I want to see numbers rising all the time. But it's fascinating to me to see the patterns that exist even in the United States. I mean, I'm surprised how low the cases are in California, a place with 40 million people, compared to New York State and other places.
Yeah.
And
Yeah.
I mean, it could be a lack of testing. Who knows? But
Well, there is the worldometer. You can see
yes,
the
I
number of
look at
tests
I
per
look at the
million.
worldometer. That's one of my sources.
They have the tests per million as well.
Yeah,
You have that number.
yeah.
That yeah, I'm always looking at that, and I actually signed up for an epidemiological course from Imperial College London,
Oh, that's
Imperial
the one that
College.
had the Imperial College had the
Yeah,
famous
so it's
report.
quite fascinating to look at that perspective. So there are a lot of courses available, and that could help you also ease your mind a little bit. Whatever, like bring some fun if you can into
Yeah,
your day as well. I know it's
yeah.
not easy, but
I always say my one of my famous sayings is always remember to put the N after FU. So when you're really upset at the world and the government and your neighbors doing stupid things, and we've had beer parties in the local alley or so,
really,
yeah, idiocracy does happen even on a local level.
yeah, those are called COVIDiots,
Yeah,
right?
they're COVIDiots. They're having their little COVID. What would we call them? They're not
COVID.
COVID coffee clutches because they're not drinking coffee. They're drinking Corona, and Coronado stuff from the Coronado Brewery, for example. The challenge is that the police can't control them because it's on private property.
Mm.
And so even though there's a stay-at-home order, then there's a question of, are people going to be responsive, and are they going to be responsible to the health of other people around them? So this is where you really see humanity as a group versus individuality,
Mhm, mhm,
and being willing to set aside your individuality for, I guess, the good of the herd as opposed to herd
mhm,
immunity.
mhm.
It's just this notion. Public health is an issue which depends on the responsibility of individuals and their ability to reason rather than to just have an emotional reaction.
Yeah, I posted something about Margaret Mead spoke about years ago about the indicator of a civilized community is
Yeah,
when you carry somebody on your back.
right,
You care about your fellow man,
right.
and the impact. I mean the beauty of it is it shows how connected we are.
Yeah.
Everyone is
Oh, yeah.
connected in
I
so
mean, this is
every
this is
way.
pretty. This is, I think, just in and of itself. When you think about it, can you imagine if we were doing this, say, like 1990 or 1992? No internet, no real cell phones of anything other than these bulky things. No Netflix, no nothing. Can you imagine 20 years ago how we would be responding to something like this? We're in such better shape in terms of communication, connection, building rapport, caring for other people, and communicating good information, sometimes bad information too, that we're in a better position than this had this happened maybe 20 years ago.
Yeah, I mean, we are fortunate because there is this connectivity, and you know, for even if you're alone in the house, I mean, it's a little bit more difficult, but
Yeah,
picking up the phone.
my sister's alone at her house and she can't
So's
travel
mine.
anywhere right now.
So's
So
mine.
yeah,
And she apparently what they're doing in Vancouver, she lives in the Vancouver area, is they come out at 7 o'clock and they start clanging pots and pans.
right. That's common in various places like
Yes,
New
people are
York,
doing
and
it.
yeah,
I mean, you
that's
learn these little trends, these little micro trends going
yeah.
on in different communities, and it's quite. I
Well,
think
it's a sense. It's an expression of compassion. It's an expression of
and
caring
community.
for more than just yourself. And expression of community and building community.
Yeah. Yeah.
And I think that through this, despite physical distancing, we actually have the opportunity to connect even more than ever before. I've spoken to people I haven't spoken to in probably 10 years, 5 years, 15 years. And that's because the opportunity has arisen to be a little more reflective, to be more thoughtful, and to take the time to connect and to maintain or nurture or restore those old relationships.
It's a beautiful thing. It's a beautiful. Yeah. I spoke to my cousin who I think it's 20, 25 years ago. He saw a post, his wife saw a post, and we connected. And it was, by the end of the call, we were both looking at the Worldometer stats, comparing them. I mean, it is a bonding, and that's probably the most beautiful thing to come out of all of this is.
Yeah, because I think the connection is more restoring than having an infection.
Yeah.
And not to diminish what it is to have this dis-ease, which we label as disease, but if your immune system is working properly and you're not having other types of, like a cascade of other things like the cytokine storm that people talk about too, which is sometimes worse. Having an autoimmune reaction is worse sometimes than having the infection itself. That, I mean, to me, it's just a case of focusing on good health habits, staying hydrated, taking my famous vitamin C. I like the ester C because it hangs around a while. I've tried to get some other products like Metagenics and a few others, and I'm amazed at the people who are price gouging on some of the products that I normally would have.
Yeah, yeah.
And that part is disappointing. If somebody offers something to you that's $35, you think that's great, and then they charge you $25 shipping.
Yeah, I haven't experienced that. I've gone to my supplier for certain things, that I need, but I haven't seen that yet. Yeah,
it does exist, but you see it in places like Amazon and eBay and other places. I think as things come to, I won't say it's a new normal, but as we achieve a new reality and people get into a rhythm, I think that rhythm eventually will carry us through with having regular, reliable supplies, price stabilization, eventually people getting back to work, but more than anything else, just having a ton of testing everywhere. And I think that's the real key, is test everybody, even the asymptomatic ones.
I did want to say something about this isolation, which people talk about how harmful that is.
Right.
Isolation mentally and emotionally. But I think in many, many ways, we are more connected now.
Oh, yeah.
There's less isolation, really. It's not social isolation. There is not social.
No, it's not necessarily social distancing as it is physical distancing with social connection.
Yeah, it's physical. Yes, exactly. It's physical, but we still have even more social connection.
But I'm not going to. I am not going to ignore the hashtag social distancing because that is popularized. I'm not going to try and change the lexicon because I think it should be different.
Right.
I think the way to do it is just to use what are the common words and phrases to get the point across.
I see this. Sorry to interrupt. I see this image. You know how you see a lot of, we'll say millennials sitting beside each other, looking at their phone, right?
Right.
On a park bench. Now it's like they are doing what we're doing, and they're actually talking to each other.
That should be, yeah, exactly. I think the idea of talking to each other is new to a lot of people. Yeah. I've seen so many folks who are they're staring at their phone like all day long, even crossing the street with your phone. Mm-hmm. And I just wonder, I think that may be, sort of natural selection at work too, because one of our crossing guards in this area when school was in session used to tell me that when he would see a kid crossing with their phone like this, walking along, what he would do is he would stand directly in front of them in the middle of the crossing walk till they came up right to him. And he would just say, "You need to pay attention. So let this be a lesson to you."
Well, I used to say, what makes us different from most animals is the opposable thumb, right? And then I thought, well, we're going to only be using the opposable thumb, so we won't even have these because, of all the texting and everything like that. But I don't use my thumbs for texting. I'm old school.
Oh, you're using a keyboard.
Well, no, for texting, like on my
No,
phone, I
yeah.
don't use my thumbs because
I have
it
my,
requires a totally different skill, I
no,
think.
I've mastered the phone thing. And then but my preference many times is to have well, because I'm an Apple fanboy, is to have my iMessages come through my laptop, so my MacBook, so I can just kind of type away really fast. The funny thing is, people can't tell when I'm doing it on the keyboard or if I'm texting with my thumbs because I've developed the thumb skills. It's
Oh,
like
yeah.
Malcolm
But is
Gladwell.
that important that
I've
people
done
know?
10,000 hours of thumb.
Oh, so you're
So,
an expert.
so I'm an
Malcolm
expert.
Gladwell.
I'm an expert thumb person. So now I could do 2 thumbs up. And it's not just an expression of approval. It's actually, I'm working on exercising.
There you go. The opposable thumb.
Yeah. I'm not opposed to using opposable thumbs, just in
No,
case you're wondering.
good, good. No, most people shouldn't be.
Show me a post.
So
Hey,
yeah, with regards to taking good care of yourself, enhance your immune system as much as possible,
and
doing
that
smart things, hydration, which is what I just saw you do.
hydration. I have, the funny thing is, because when you're indoors and you're not exercising as much as you might, or it's not super hot outside or inside the house, the tendency is not to drink enough water.
I know. I've been
Yeah.
having cramping in my legs lately
Yeah.
at bedtime at night, and I thought, well, I think I'm drinking enough, so I need to sort of like measure to make sure that I
Yeah.
am, just to give myself that.
I'm getting to the point where I want that 64-ounce thing right here, and I just want to see that thing the level go down as the day progresses.
I just bought a huge jug of Kangen water, and
What?
Kangen.
Oh, I thought you had canyon water, like you were collecting it as it was dripping down the
So
side.
it's supposed to be very therapeutic. So I will report on that.
Report back after a week of Kangen.
Yes, I will.
Kangen?
I will. Kangen. Kangen.
Hmm.
It's a whole system.
Okay.
And but I'll let you know more about that later. So do we have any other people?
Wait, Michelle, otherwise known as Mickey. She has another set here. Says, "Are y'all on YouTube?" We're going to get to the point where we all are going to be on YouTube. But what we're going to do here is we're going to take these broadcasts, even though this is now, I changed the group to private because we were being spammed. And so I didn't want that to be an issue. So now something that comes through has to be approved. But I found a way to download videos from a private group, which is not as easy as you may think, and then re-upload them to YouTube. Because we have a YouTube channel now, which is Total Health Live. Once we get to 100 subscribers, so please tell your friends and family to subscribe, we'll be able to get a much easier domain name. We'll be youtube.com/Total Health Live. But for now, since we're under 100 subscribers, it's a really long URL with a lot of numbers and letters. But I will enter that YouTube address in the comments here too. So if you want to share that, that's perfectly fine.
That is really great.
Yeah, it's a little challenging sometimes when you're doing live video broadcasts because it's the repurposing, downloading, uploading. Some of the technical stuff can be a little challenging in these challenging times. A friend of mine said, for God's sakes, if you're doing emails and anything else, please get rid of the phrase challenging times. Because every marketer and brand out there is using that challenging times business. So.
Well, you can't use COVID, I guess, in a subject line anymore for some reason.
You can sometimes. I have a friend who did a lot of coronavirus ads on Facebook and did not get shut down. Because she was talking about business strategies for coronavirus.
I just saw an article my sister sent me. It was about how some governments are not allowing people to even use that term, coronavirus.
Coronavirus.
Which is,
well, I mean, COVID-19, I mean, it really is a SARS. It's a sudden, you could say SARS, but they might not let you do that either. There's one of our friends, Rachel, has a huge Facebook marketing group, and she teaches amazing stuff. And she will provide us periodically with lists of forbidden Facebook words and okay Facebook words, and it's based on thousands and thousands of ads that they run and that her students are running. and to see which ads get shut down. So it's really interesting. You could say something like beneficial habits as opposed to COVID-19 coping strategies.
Well, I like to use things like stay away from the cookies.
Stay away from the cookies.
Yeah.
The cookie jar.
Stay away from the cookies.
Let's when we get together after this is all over, please don't come 30 pounds over.
Now that is a very long subject line.
It is. I mean, I just step away from the Oreos.
Even vitamin C in the subject line isn't really having an impact because we all know, vitamin C is a good thing.
No, we don't all know. Some people just, I have so many people that I know who say, well, I ate a banana, therefore I've got sufficient potassium levels. Like, no, you didn't. Mm-hmm. Or I get vitamin C because I eat an orange every other day. Well, no, you did not get sufficient vitamin C.
Yeah, I mean, we're talking about.
Whoops, did you freeze? Oh, Monika froze. The frozen Monika. Somebody must be doing a lot of video stuff. So Monika, I'm going to push you out and you're going to come back in again. So I'm going to bump you and you're going to come back. So anybody got any other questions, or do you have anything? Do you want to just come on? I've got the link down here in the group. You just hit that little StreamYard thing and you can come here and keep me company while we wait for Monika. Michelle says, good. Yeah, we all are on YouTube. Oh, Dyer. Wayne Dyer is very calming. Yeah, I would agree with you, Michelle. That's really true. Wayne Dyer is great. I have a lot of his original stuff. Let's see if Monika can get back in again. Here she is. Yeah, and you are... Oh, she disappeared. Well, that's good. Hit me up again, Monika. Something happened there with your bandwidth. Hail, hail, the bandwidth's all here. What the heck do we care? Yeah, we really do care that you have sufficient bandwidth. There's homeschoolers around here now too, but I think it's mostly streamers and others. Are you there, Monika? Come back, Monika. Come back to me. You can do it. Hey, Michelle, Mickey, want to come in? It's a private group, small space. Come on, you can do it. One of these days we'll get you on here. You're full of great information. Michelle is an English teacher, and I have nothing but respect for teachers because most of my family were preachers and teachers back into the 1590s. So, well, I guess Monika has disappeared. I'm going to give her a couple more minutes. Any other questions that you might want to put in the comment section? Anybody there? I know there are 3 of you there while we wait for Monika to return. Monika. Where are you, Monika? I feel like I'm on an episode of Friends. Monika, Chandler. She's got to be out there somewhere. Well, I guess Monika has lost her connection, but we don't want to lose our connection with you. So if you have any questions, why don't you let them in there? I'm going to put the link here, that thing that says StreamYard. You can come back in here, and if you hit that link, you can join me. Let's say hello. You can say hello and goodbye. How about that? No? All right. Well, we have lost Monika, but we will find her again. I guarantee. So, on behalf of Monika Klein, I am Dr. Christopher Vogelmann, wishing you great health, peace of mind, and be sure to stay safe out there. We want you back here to hear us next week. I think we're going to go for 1 o'clock again Pacific time. That will be 4 o'clock Eastern time, 3 o'clock Central. And for those few lonely members of you who are in Denver, Utah, or other places, that will be 2 o'clock Mountain. So until then, see ya. Take care. And I am out of here. And put any questions or comments that you have in here. We'll be sure to get to them later. I will put the YouTube link in there. So please subscribe. Thanks a lot. Talk to you later.